today's in-service, we are going to cover the Acquire S fine needle biopsy needle. In my hand, I have a 22 gauge needle. However, we have a 25 gauge needle as well for the Acquire S needle. If you are using a legacy needle for the Acquire portfolio, we have a 19 gauge, a 22 gauge, and a 25 gauge. The difference between the stylet on an Acquire S needle and an Acquire legacy needle will be the tapered point stylet versus a blunted tip stylet. The Acquire S has a tapered point stylet, which is a sharp stylet. Upon removing the device from the package, you will notice that there are two components. You have a 20 ml luer lock syringe, which can be utilized for wet suction or dry suction. There's a stopcock located on the syringe and a luer lock port that you can attach to the very proximal handle of the needle. To create that vacuum pressure, turn the stopcock into a perpendicular position and then pull back that syringe, locking it in place at the 20 ml mark, and you can see there is a ledge within the syringe for you to turn the piston and lock it in place. This can then be luer locked onto the proximal handle for the physician to activate that suction on the syringe. When removing the needle from the sheath, remove it in a U-shaped position and check for any kinks or damages along the catheter. Upon handing to the physician, hand in that U-shaped position. If the physician would like to use a slow pull stylet technique, locate the stylet at the very proximal part of the handle. Once again, this is an Acquire S needle, so the stylet is sharp. The physician can use this on their initial puncture. When the physician is engaged into the collection, slowly pull back the stylet while the physician makes the actuations. If the physician does not want to use a slow pull stylet technique, you can remove the stylet from the catheter. You can coil and then lock the coil in place at the very top part of the handle. This will ensure that that stylet does not run all over the table when you put it down. If the physician would like to use a wet suction or a dry suction technique, the syringe will come into play. You can luer lock the syringe onto the top part of the handle, and then the physician will have control of when they want to activate the suction technique. Other components to have ready for this procedure would be a saline flush, a dry flush, and then a formalin container, or any other fixative that the physician would like to expel the specimen into. Work with your physician on how they would like to use the technique for expelling the specimen. An air flush, a saline flush, or just the stylet alone. Once again, that will be up to the physician that you are working with. Thank you.